Hey, friends, welcome to another episode of the ASAP Pathway Podcast. I'm your host today, Dr. Stacy, and I am honored and thrilled to have our guest today, Dr. Soroush Zaghi. Welcome.
Thank you so much. Thanks so much for having me. I'm excited to be here and help have a discussion that can hopefully help a lot of people learn more about these topics.
Amen. That's like the whole point of this, is we're just trying to educate. And really, I think it's a wonderful era for patients. I think you're seeing more self-directed care. Um, you're seeing more autonomy and the patients trying to be their own advocates for themselves and their families. And I think things like this, these kind of conversations empower patients to um, ask more questions, do more research, maybe get the second and third opinion. So I would love to introduce you. A lot of people know who you are. Anybody who's anybody in sleep and airway, they know who you are. But I would like to just do an abbreviated. His bio is huge. His publications are plentiful in literature. So let me just go into your background here. Dr. Zaghi graduated from Harvard Medical School, completed residency in ENT at UCLA, and sleep surgery fellowship at Stanford University. He now serves as medical director of the Breathe Institute, where the focus of his subspecialty training is on the comprehensive treatment of nasal obstruction, mouth breathing, snoring, and obstructive sleep apnea in children and adults. He's very active in clinical research with over 90 plus peer reviewed research publications in the fields of neuroscience, head and neck surgery, myofunctional therapy, and sleep disordered breathing. He is particularly interested in studying the impact of tethered oral tissues, such as tongue tie, and oral myofascial dysfunction on maxillofacial development, upper airway resistance syndrome, and obstructive sleep apnea, especially as it relates to pediatric populations. He's an invited lecturer, author, and journal reviewer for topics relating to the diagnosis and management of sleep disordered breathing and tongue tie disorders in children and adults. So I kind of wanted to start off with how you're not your typical, like, I try to get people to understand this. Like when I lecture, there might be medical doctors in the audience or dentists in the audience, and they say, so how do I find an ENT in my area to collaborate with? Because, as we all know, not all dentists understand sleep and airway. Not all ENTs are really progressive with sleep and airway health. You think they would be, you would assume that, but it's not always the case. So, how did you get started on this journey, Soroush? Like, what the heck? You're so unique. I mean, people
Ab-
come from all over to see you.
Amazing. Yes. Thank you so much, Stacy, for that amazing introduction. And, it really started in medical school. I was so excited to be able to attend Harvard Medical School. I mean, when you go to the campus, it's absolutely gorgeous, and the history of the
Mm.
institution and the professors and all the research that comes out of it. It's really grand. And, sitting in the classroom there with your fellow students, I'll never forget on the first day of medical school, the dean came and said, welcome to this amazing, prestigious medical school. We're here to teach you everything you need to know to be a medical doctor. But more than that, we're going to teach you how to think, we're going to teach you how to learn, and we're going to teach you how to develop the next generation of care in medicine.
Mm.
And it's really with that kind of approach that it's not just, hey, here are the textbooks, learn it, here's a test. Rather, the approach was, here are the textbooks. Half of what's in it is wrong.
Right. It's
These
already not
diagrams,
relevant any
yeah, not
longer. And
relevant.
yeah,
They're like, we wrote these books. We developed these figures. And I'll tell you, when we're putting these figures together, some of it we simplified, some of it is already outdated, some of it's going to be outdated. So instead of forcing you guys to memorize these cycles and things like that, let me give you some insight into how this developed, how it changed. And it was that appreciation that medicine is constantly changing, and that what we know about medicine is really only like 1 to 10% of what can be known, that allowed my mind the capacity and the drive and the desire that to help transform and advance with growing technology. Similarly to our society, the iPhone came out when I was in medical school back in 2006 era. Okay,
Yeah.
and wow, what an amazing innovation, the iPhone 1, right? But if you're still on the iPhone 1 in this day and age, I mean, you're a little bit behind the times. Not to say that it wasn't an amazing advancement at that time. And so, as technology increases, as our awareness increases, we're able to do more and understand more. I think that medicine should also change. Yet, along many in academics and people who are, very traditional, especially the insurance-based model, they're not open to that change. And they're not open to that change because the insurance requires, these older guidelines. And if new
Yes.
treatments don't conform to the old guidelines, they're not going to be implemented by the doctors that are in that model and in that system.
It's
The
so
second,
true.
the second really aha moment for me was the fact that a lot of medical school is based on medicine. Okay? Medical school teaches you how to use medicine, literally pharmaceutical drugs, to help treat, manage symptoms. And it wasn't until after I left medical school, residency, fellowship, and I got into the community that I really realized that there's a lot more that we can do to prevent disease, to optimize health and well being that doesn't involve medicine. And when it doesn't involve medications in the pharmaceutical industry, there's a huge bias against funding these studies, publishing these studies, and it's really all rooted in the way that we are taught to understand the scientific method.
It is so this is such a we could have a whole podcast on this topic by itself because I think a lot of what we're battling, even in dentistry with sleep dentistry and um, dentistry in general, it's the same thing. What you learned in dental school, like half of it is not even relevant anymore. You have got to stay up on um, what is being pushed out, the literature that's coming out. You have to be in contact too. It's not just the literature, you have to be part of your dental community, medical community. Like, what is anecdotally even happening in everyone's practices? Are we all talking as colleagues? Or are we operating as little islands? What's working in your office? Maybe I try that in my office. Let's look at the different phenotypes of patients and maybe we start doing things differently and really listen to our patients. Um, I think it's so interesting that, I mean, wow, Harvard Medical, that's, I, I, I I would have to say that's pretty impressive that they at least admit that when your first day of medical school, like half of what's in these textbooks isn't even relevant anymore. But even just to raise up the next generation of care, and and that is exactly what you're doing. But there are obstacles, Sarush,
Hmm. Yes, and the
and
and the
it's not
main
just from
obstacles.
the universities; it's from colleagues that don't want to change.
Absolutely, absolutely. When you're talking about innovation, right? There's different approaches to it. You have some people who are inherently innovators, and if you are an innovator and you have that innovative mindset, you're gonna be open to change. You're
Right.
gonna be ready to move beyond traditional methods. And on the other side of innovation, we have laggards. And the laggards are inherently resistant to change. The change threatens their way of thinking, their way of practicing. And as such, there's an inherent bias in the way that they view these concepts and these ideas. Okay? The idea that you can heal through diet, nutrition, lifestyle is threatening to
Yes.
a lot of medical doctors who understand these things only from a medical perspective, that that disease has to be treated with antibiotics, and if you have ADHD, the treatment for ADHD is ADHD medications. And to me, it personally outrages me that there's funding for studies that have approved ADHD medications based on randomized controlled trials in children as young as 3 years old.
Oh my goodness gracious.
There is level one supposed scientific, double blinded, randomized controlled trials on a variety of ADHD medications with specific algorithms that if the first one fails, here's the second one, here's the third one. And if you have side effects from these ADHD medications, I'm sure you know what the solution is. It's medications to
To
specifically
help with
treat
the
those
side effects.
help with the side effects.
um,
Rather, we should be taking more of a root cause approach.
Root
And
cause, yeah.
I have particular interest in the field of osteopathy. So
Mm,
there's allopathic medicine that's heavily focused on pharmaceutical interventions, and there's osteopathic medicine that also has a very rich history. And this is about how we can minimize disease by controlling stress, meditation, diet, physical well-being of the muscles and bones in the body. Wow, what a concept. Yet, you can't do a randomized controlled trial with osteopathy. You just can't randomize or blind someone to those interventions. There's no placebo intervention for these lifestyle holistic measures. And so there's a bias against them saying that
hmm.
they're not,
Already set up. Yes.
yeah, that they're not based on high level evidence.
It's
And
interesting too with osteopathy because I have friends that have more of an osteopathic background, and it's interesting. Like I've always naturally chose, you know, osteopathic medicine more, like for my, even as my pediatrician, they just seemed a little more open, but um just so much is even coming out with oh, you know what? Are you sharing your screen?
I do want to share this just
Then
as
let
one
me
slide.
yeah, can
Okay.
good. I want to show
Okay.
make
So
sure
let me
everybody
just show
can
you
see
this
this.
one slide. Okay. And so this is a slide on it's for pediatricians. Look at this. Cohen's Children's Medical Center, right? If a
Oh
kid
boy.
comes in with ADHD, here's the guide. All right.
Just a nice little
Amphetamine.
laminated of like I don't know,
Oh,
there's probably
oh my
40
gosh.
40
Okay.
plus meds
And
on
then
it.
look at this. Adderall is approved for 3 to 5 years old. Oh my goodness. Okay. Here are the studies that support like FDA approvals for the uh, I mean unbelievable.
What's
Right?
interesting too is, oh yeah, here we go. Short-term side effects, long-term side effects.
And then if you have a side effect from it, the answer is more medicines, right?
Yes.
I
Like,
mean
look,
this
they're
this this
adding
this this,
another two or three medications
this
depending
makes
on
me
what the
sick to
side
my
effects.
stomach because a
It
lot of
does.
ADHD, most of it is because kids aren't sleeping well, they're not breathing well, they're stressed, they're eating high fructose corn syrup, they're having seed oils, there's pollutants and contaminants in our water, in our air. And, chronic disease is now among kids about 50%, where maybe 10
Yes.
years ago it was about 5%. The incidence of autism is increasing. I mean, something's going on, and we got to take a close look at what that is.
100%. And Dr. Stephen Sheldon, he is a pediatric sleep physician out of Lurie Children's Hospital in Chicago. And he has stepped out and said, as many as he believes 90-95% of ADHD is really, it's more of a symptom, not a syndrome,
Mhm.
or I'm sorry, it's more of a syndrome, not, a disorder. And we've been
No,
calling it a disorder, and it's a syndrome of something. It's a symptom of something underlying, and he believes it's sleep deprivation. And also, you've got 3 and 5 year olds that they're playing around with medication. Um, but we know that neurocognitive deficits are going to get kind of locked in by age 6, 7 if you don't get to them. So instead of like really looking at, let's talk about why these children cannot focus, cannot sit still, maybe have oppositional disorder, maybe they interrupt all the time, can't focus. Why don't we ask more questions as to the why behind it and get them the help, maybe a sleep study, a visit with an ENT, sleep physician, before we throw these kids into these medical trials with medicine?
Absolutely.
And what
Absolutely.
your
You
point
know,
to your point too on like seed oils, diet, environmental factors, there's so much emerging right now in sleep medicine on gut health and it being so linked to even just desaturations on their own, changing gut microflora. We can see changes. You can increase or decrease oxygen desaturations by changing the gut microflora. So something is going on. Anatomy matters, but why is the anatomy changing? Why are we seeing stuffy noses and huge adenoids, which are now changing the direction of growth and development? We have to look at diet. We have to look at environment.
absolutely, absolutely. The gut health that you mentioned is so important. The foods that you eat are, digested by bacteria that's in our stomach. And when we're treating kids with antibiotic after antibiotic for ear infections that may be resolvable by some other, diet intervention, chewing, myofunctional therapy, tongue tie, palate expansion, breathing treatments, saline rinsing, tongue posture, you're really altering that gut microbiome, and this can in turn cause problems with digestion. For example, digestion of milk products.
Mm.
It can lead to problems with dairy digestion, for example. And then once those bacteria are killed, and you're having, the poor diet that we have in our society, you're not able to further digest, and so now you have chronic inflammation as a result of that, and the chronic inflammation further results in inflammation throughout the body, tonsil adenoid enlargement, and it really leads down a cascade of interventions.
I would love to just expand on that topic just a little bit because as a dentist, when I refer, so I'll take a CBCT, patients, parents especially bringing their kids in. My child has been to two different ENTs. They don't want to do anything. Lips are chapped, crusty noses. They say they're not big enough, or this isn't, it's not affecting their life as much, and they don't want to do anything. So they'll bring them to me. What do you think? And of course, I'm going to try for a third opinion because ultimately, if a child cannot breathe through their nose, we're not done. So something is amiss. But a lot of the parents will get nervous, like they're assuming, well, all ENTs want to go in and do surgery first. And I know some amazing ENTs that feel that diet isn't as relevant to tonsil and adenoid enlargement. They think it's more resident viral load that just kind of has been hanging out. That the research shows that it's just mostly like viruses just laying dormant in there, and there's nothing you can do, and you can't reverse that, and you just need to get the tissues out. What is your what is your path when someone walks in the office? um, do you automatically look at more conservative approaches first? Because I have seen some pretty amazing CBCTs where by some pretty reputable orthodontists that are like, holy cow, the only thing we did was we removed dairy and we
Hmm.
changed diet, and they're back 2 months later, and these adenoids are like almost gone.
Absolutely, yes. So dairy, there's actually a study, I'm kind of looking for it now. Let me see if I can pull it up for you. Dairy has been shown to increase nasal congestion, all right? So here's the slide that I want to share with you here. This says effect of dairy on nasopharyngeal mucus secretion. And what they found is that they had everyone at baseline in terms of how much mucus congestion they had. They put them on a dairy-free diet. Everyone's congestion dropped. Then they randomized them to either a soy milkshake or a dairy milkshake, and the congestion came back. And this is
Mm,
among people who are not allergic. It's a level 1B study, so it's a double-blinded, randomized controlled trial among almost 100 individuals who were tested and did not have allergies to dairy products. Now, there is a variety of reasons why dairy may be irritating. One of them is thought to be related to the A1 protein that's in milk. The other is the prominence of lactose that about 25% of the population is sensitive to. So I have for sure seen when kids come off of dairy as an avoidance, we see dramatic improvements to systemic inflammation and sometimes tonsils and adenoids as well. Yet there are two other solutions as well. One is they can consider the A1 protein milk that they may see in the grocery aisle. And there's something else that I personally take. It's called Bactose. This is a really cool probiotic. Okay, so
Mm.
I'm lactose intolerant, and this probiotic, you take the 7 capsules. You take 14 capsules in 7 days, and then if you just take it for 1 week, it helps develop bacteria in your stomach that digest the milk for you.
How
So
long
it
does that last?
it
And
lasts 1 to 3 months.
interesting.
So if you have lactose intolerance you're avoiding, like I had to take like a lactate pill every time. Now I take this like once a month and I'm good. Any dairy product. It digests both the sugars and the proteins, making the dairy a lot less inflammatory in your gut. So especially if you just had a round of antibiotics, you're going to be unable to digest the milk, and then you get more inflammation and your ears are killing you. So that's like literally the worst thing you could do. Be on antibiotics and drink milk at the same time.
Well,
So
and once those bacteria are gone, unless you do, I mean, how do they ever
you're
come
not
back?
even if you go to this store and try to eat yogurt and you think yogurt has it, the yogurts that's in the pharmacy, they've done studies. There's no probiotics in there. There's only high fructose corn syrup and preservatives and things like that. It's not real live cultures. Even the ones that say like live cultures, that are
Yeah.
with preservatives and all that. Uh, those are not. You got to get like really down to it.
So if well, like
Yeah.
antibiotics are given
So,
out
so
like
first of all, I
candy. So
minimize personally. If I do tonsillectomy, you get 1 dose of antibiotics at the time of surgery, but no antibiotics post-op. And I heavily emphasize to parents, heavily emphasize, you have to brush the teeth. You have to keep the mouth clean. You have to rinse, okay? Because if you don't, you will get an infection, okay? And the infection will cause bad breath, bleeding, difficulty swallowing. So I am upfront. So I do like a xylitol mouthwash and a xylitol mouth spray, keeping the mouth clean, brushing the teeth. And my kids don't need to do antibiotics after tonsillectomy, for example.
that is
Now, if
phenomenal.
yeah, and if on the contrary, you have a tonsil infection, you have an ear infection, you go on antibiotics, and then all you're eating is dairy, 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 you're not able to digest it because you're on the antibiotics, and most of the digestion happens because of the gut microbiome, you're gonna get more inflammation and more inflammation. And then what happens after you fail the first round of antibiotics?
Oh,
It's
we're gonna
another
switch
round
to
of
another
antibiotics,
round of antibiotics.
and
Yeah.
then another round of antibiotics, and then it's another round of antibiotics plus systemic steroids, and the systemic steroids increase cortisol that further alters the gut microbiome that causes systemic. It's just, so the two main things I've learned about since leaving medical school, that I mean, I graduated from Harvard Medical School, UCLA ENT, Stanford Sleep Surgery, is the importance of the physical body, the muscles, the bone, professional body work in terms of osteopathy, chiropractic adjustments, deep tissue laser therapy, craniosacral therapy, fascia therapy. I think it's like a big travesty that
Mm.
medical doctors don't know about these modalities and the difference between them. That's number one. Number two, genuinely, diet, nutrition, gut health is so underappreciated. It is so sad. It is
It
so
is.
sad, you
It
know?
is if you look, and Stasha Gomenak, she's someone I studied under, like helping me better understand the role of vitamin D and all the B vitamins and gut health. And she says this a lot, that the gut biome is really an organ. And we are walking around. I mean, we cannot function without that beautiful symphony of bugs. And we just have horrible gut health. And our children probably are the sickest generation when it comes to just natural health. I know we have a lot of advances in medicine and things like that, our children are living longer and we have more survival of births. And I understand that. But just inherently, we're seeing allergies through the roof.
It's
We're
crazy.
seeing, yes, all of this stuff.
I have friends who come from like Europe, and they're healthy in Europe. They're doing great. They come to the US for a new job or better economic lifestyle, and they start getting problems with eczema and inflammation and allergies, and you wonder why. My wife, Dr. Nora, is really into this, and she has has an Instagram at Dr. Nora Zaghi, where she talks about the nutrition aspect, and I learn a lot from it. But one thing that's kind of outrageous is that the same foods in the US versus Europe are made with different ingredients. So here's like a little website that I pulled up that shows like McDonald's fries, what they put in it in the US versus what they put in it in the UK. Here's a Quaker Oat simple. You can see, simple ingredients in Europe, but in the US, they're adding a whole bunch of additives, including, red dye 40 and,
Oh my
you
gosh.
know, sunflower and palm oils, which are not present. You can look at the Mountain Dew is different. The ketchup is different. The ketchup in the U.S. is made with high fructose corn
Fructose corn
syrup.
syrup.
As it's just corn syrup, it's sugar. Yeah. Whereas in Europe, it's actually there's no high fructose corn syrup. Like it's crazy. It's crazy how
Oh
the
my, that
foods.
list is impressive. Is that on her Instagram? You said
This is
Nora.
just online, but a lot of
Okay.
different people talk about it. But my wife has a very specific interest in this, and so she's very strict in our home. Everything is organic. All the water that comes in is in bottles, and she's very particular about type of oils that we use. Like she won't let us go out to eat at a place that cooks with vegetable oil. It has to be olive oil or avocado oil, and these things are important. These
They
things are
are
important.
important and we minimize
You
their importance.
we go to Europe for a week and you feel healthy, you feel alive, you eat as much as you want, you don't feel sick, you lose weight, you're eating more, you're losing weight. Like why is
Yes,
that? Why is it in
I've heard
Italy
this from
where
people.
people are eating pasta and olive oil and they've done studies on it that
And
hey,
breads, like their breads, their wines, their
they
all
eat
of the
bread, wine, meat, okay?
yes.
And they're living longer and they're healthier
Yes.
and they have look like what's that? Why is
And
that?
somebody, so I was talking to someone who is from Australia, and they said not only it's just even the way our country processes dairy.
Right.
So
Wow.
dairy is one thing, but then how you process the dairy is very different in like Australia or Europe. So there's even the processing aspect is very different here. Um, and when you listen to us talk about this, it almost feels so heavy because there's so much that needs to change, Soroush. It's like, where do you even start? And all you can do is just start with your own family, and do the
Absolutely.
research because to change an industry, it's going to be a long uphill battle. The sicker we get, the pharmaceutical companies just come out with more medicine instead of looking at more like we were talking osteopathic, more natural, holistic approaches. Um, I mean, you just go back a few generations to our great grandparents, and, granted, they had their own hardships. Okay. I'm glad I live in the time I live. That's for sure. But if we could just adopt some of the things that they did, being outside more, getting vitamin D, um, less screen time, how they handled community, they ate from the ground. They didn't have grocery stores full of preservatives and crazy ingredients that, I mean, really, when you look at, I mean, you're an ENT, so of course anatomy is important. I'm a dentist. Of course anatomy matters, but there is something happening before the anatomy changes that we're not addressing. And we are all here to help. The anatomy needs to be helped. Like
Hmm.
it's like the chicken or the egg. Do I take out the tonsils? Do I take out
Hmm.
the adenoids? Do I do the expansion? Do we change the diet? The answer is yes. Well, what do you do first? Well, it
Love it.
all needs to be addressed.
Love it. So I'm glad that we're getting to this aspect of it of like, what can we do now? All right. So I just want to frame the conversation in that, what we're doing now is an emphasis on nasal breathing, myofunctional therapy, addressing soft tissue inflammation, tonsils, adenoids, palate expansion, and we'll get into it. At the same time, we'll say that, hey, maybe in 5 years, maybe in 10 years, we'll be approaching these things in a different way, hopefully through diet, nutrition, better water, better air quality to get to the root cause. But now that we're here, what can we do on a day to day basis to kind of help our families, live their best self, right? So, number one, nasal breathing. All right. So, you want to make sure that your children, adults, everyone is breathing through their nose more than 90% of the time. When you're breathing through the nose is the natural immunity that's going to help protect, going to help moisture and humidify the air. It's going to keep you healthy. It's going to help optimize your breathing, prevent your saliva from getting dry. When the saliva gets dry, it changes your oral pH, your gut microbiome, and that's often the start of the problem. Also, when you're mouth breathing, the tongue is low. Low tongue posture leads to collapse of the dental arches, forward head posture, neck and shoulder tension, and so the cycle of dysfunction continues. If individuals are in this and they don't know where to start, the best place to start is to reach out to a myofunctional therapist. These are highly trained individuals, either from a speech or dental hygiene background, who can evaluate and see what's what. Sometimes you can get by through diet change, saline rinse, nose sprays. Sometimes you do need to remove the tonsils and adenoids. Sometimes you do need to address problems with tongue tie. And, palate expansion is something that I'm so excited about because of my personal journey with it recently.
I remember watching your journey, and I think your lovely wife, did she kind of complete the journey for you with some cosmetic work as well?
She helped guide me and encourage me, but it was my colleague, Dr. Victor Kachaturian,
Yes.
who,
Okay. So he was
who
involved. Okay, gotcha.
yeah, so
I
she
noticed she
told
was.
him what she wanted. She's like, I want it like this, and like make the color like that, the
Oh,
toothpaste like
beautiful. Make my
this.
husband look like this.
Yeah.
I love it. Yeah, you have a phenomenal, it's a fun journey to watch. Again, too, we've got the orthodontic community. There's a lot of conversation happening that wasn't happening 5 years ago. Definitely not 10 years ago. So we're seeing a shift. We're seeing a change. Conversations are happening. What about within, your profession among ear, nose, throat specialists? Not all ENTs, just like not all dentists, not all orthodontists, not all sleep physicians have the same knowledge base. And there might
Uh-huh.
be some internal resistance happening. What would you say is the biggest resistance within, or is there any resistance within the ENT specialty for what you're doing and what you're advocating for?
I, absolutely, absolutely. So, to kind of comment on that, 6, 7 years ago when I started, talking about tongue tie and myofunctional, I tried going to the ENT community and they would give me like 6 minutes at the conferences, six
Mm.
minutes to talk about it. Okay. Whereas they would have like hour and a half long seminars on the best way to do tonsillectomy, right? Like the best way to do reconstruction of the back of the throat. Yet these new concepts, there's no evidence. It's not interesting. It's beneath us. It's below us. Yet I was able to find, like over this time, I probably know about 5 or maybe 10 ENTs in the country who now follow my work out of the 10,000 that are out there. So I got the good 0.0001%.
Better than
But
nothing,
that alone,
Soroush.
what's that?
Better than nothing, Soroush.
I have a following of 0.001% of ENTs follow my work. They comment frequently on my stuff, and I can't tell you. I just had a resident out of Cornell, Columbia, reach out to me saying, "Hey, I'm in my third year of residency. I came across your Instagram. I saw all these cool things that you're mentioning. I've never heard of it before. I'm so interested." And I told her I would love to mentor you. If you ever want to come by for a week, I got on the phone with her, showed her a different way, just because she's open to it, which I thought was so
Yes.
so incredible and so amazing. Um, the even in here in the Los Angeles area, a lot of it is based on insurance reimbursement. So I was a resident at UCLA, and I developed an interest in sleep and breathing. And I applied. It's a 5-year residency. I applied in my third year, and I had high letters of recommendation because I was heavily involved in research and clinical care, and I had good marks. And so the chairman called the chairman of Stanford and said, "Hey, I got this great candidate for you. He's amazing. You're gonna love him." They interviewed me and they gave me the spot. They gave it to me like right on the spot, like a week later. They said, "Hey, we're 2 years ahead of cycle, but we want you. We're gonna take you." Uh, and so I did research with Stanford for 2 years while I was a resident at UCLA. Learned a lot. I did a 1.5 year fellowship, and then I came back to UCLA to try to get a job. And it really came down to the economics and politics of it, because I gave a presentation about my vision for what my department of sleep surgery would look like. And my vision is what we have now at the Breathe Institute, which is myofunctional therapist in-house, seeing patients together, okay, alternative modalities, maxillofacial surgeries, dental interventions before considering ENT surgeries, right? Now, this is a surgery department whose funds come from doing surgery, from booking OR cases. And when he did the math of what that would look like, he said, listen, this is a good goal, but I don't know about, rubbing shoulders, and I don't know how I'm gonna, pay your salary and, fund all this work that you're doing. So he gave me a clinical position at the hospital, but he said, you're gonna have to go on your own in terms of getting an office and getting staff. Like, I don't want anything to do with that. And so sometimes it comes down to the economics of it and the insurance policies in terms of how these things are funded. For example, tonsillectomy, adenoidectomy, ENT
Oh,
doctors make about, and that's for 3 months of care. And
it got cut off. Can you repeat that again? Just it like
yeah, yeah,
froze
yeah.
up. You
ENT
said,
doctors, yeah. So if you take insurance for certain CPT codes and things like that, okay? If you have a tonsillectomy, adenoidectomy, the ENT doctors make somewhere between $300 and $600 for taking. It's the pre-op visit, the surgery, the follow-up care, and 2 months of care afterwards, okay? Which is just not sustainable in terms of the expenses that we have.
not at all.
Yet the surgery center with insurance makes about $20,000.
Oh,
Okay.
okay.
Yeah. So the hospital. Yeah. All right. Now, if you do something like sinus surgery, which is very popular, the surgeons are making $2 to $4, $5,000 per case, and the surgery centers are making, 20 to 40, $50,000 per case. And if you do a surgery where the patient has to be admitted overnight, they kept in the hospital, right, versus sent home, because most kids want to go home right after surgery.
Right,
But if
right.
they keep you, right, then there's more insurance reimbursement. So the insurance reimbursement and the economics are highly skewed against things that are in the interest of your patients in terms of getting them in quickly, and things like that. They also make you come at multiple visits. So if you come to see me in my clinic, we do the exam, the scope, the CT, everything on the spot because we're trying to get you in and out. Whereas other places, they bill per visit. So they see you, they put you on a nose spray, they follow you up. That's another benefit. They see you, they order something, they see you again, they see you again, they see you again, and the care gets prolonged. And it ultimately is more expensive in terms of time lost and the delaying care. So
Yeah,
we're
it's
here
not
talking about a
set up.
different
The
way.
system is not set
It's
up.
not, and we have to kind of talk about that and address that as one of the main factors in terms of why there's resistance to change among the institutions.
And I think what you said earlier too, and that's the uphill battle. I mean, that's a big industry. Um, and I think this is why you're seeing more physicians, dentists, sleep dentists going more concierge to practice the medicine. They want to practice outside of the paradigm of insurance driven, because it is very antiquated. You got to meet this, and this, or we won't pay for this. It's very driven towards um, illness, and not health. So you need to be a whole lot sicker before we are going to help you. And
Yeah. And
it's
it's a cat
just
and
so
mouse game
interesting.
between the hospitals and the insurance companies. So the insurance companies will come up with policies to not pay, and then hospital MBAs will sit there and come up with policies that will work within these guidelines to optimize the pay, and then they put other regulations, and so it's just this cat and mouse game of making it more and more difficult and more futile, really, because the questions are not based around how do we get this person well, regardless of cost and economics and things like that. And I'll tell you that doing it the right way is less expensive. And if we focus on the
Yes.
prevention, you'd see your premiums coming down, and you see less disease and illness and healthcare costs associated with that.
I was going to ask you, and I know I don't want to keep you too much longer because you've already, and I feel like there's a bazillion things I want to
Oh
talk about.
yeah, the time just kind of flew, huh?
It did, and this is a much needed topic. probably see if I can have you back too to talk more specifically. We could spend a whole podcast on just ties and I mean, there's just so much right now that's being pushed out. You're seeing a lot of
Yeah, let's talk about
controversy.
that.
Yeah, the controversy on releasing tethered tissues. You know, there was a really popular New York Times article that came out. Of course, the follow up one wasn't as popular, but the one that's against it was really popular and
Yeah,
viral all
yeah,
over the place. What would you like? Because we have listeners of all backgrounds. Okay,
yeah.
we have parents, we have patients, we have medical doctors, dentists. What if you could summarize the extremely political, uh, hot topic right now of tongue tie release? What do you want people to know that maybe is so misunderstood?
Absolutely. So, first of all, you mentioned the New York Times article, "The Booming Business of Tongue Tie," and I'll reveal that I was interviewed for that article. Okay, and I spent like a whole evening, hour and a half, going through my lectures, providing data, providing the evidence, framing it in a very neutral perspective, and they chose not to include anything that I mentioned. Okay, so the fact that they chose not to include that is a sign of bias. All right.
Absolutely.
Okay.
Right.
And they only chose to choose the little bits that kind of make this look unfavorable. All right. So, first of all, that is an opinion piece. All right. It's not an actual scientific, high integrity approach to the topic. All right. Uh,
Correct.
okay. Now, their main incentive in publishing an article is to get clicks.
Yes.
Okay. And to get shares. All right.
And they got
And
it.
the more controversial they are, the
Yeah.
more angry they make you, the more divisive, the more likes and clicks and shares they get. Because as soon as that article was published, the next day, I can't believe this article. I can't believe it. I can't believe it. All right. Oh, so many hits, so many views. All right. Instead, I recommend people when these garbage articles come out, let it be. Just let it fizzle. Don't say anything, okay? Instead, when these garbage articles come out, post an article by us and one of our doctors or a testimonial. Post something else instead to drive it down, all right? Because if you guys keep feeding into this, have you seen this article? Have you seen this article? They're incentivized to continue on that because all they care about is your clicks and viewership. They have no other
That's
incentive.
right.
They have
That's
no other
exactly right.
incentive. All right. That's one. Number two, when it comes to tongue ties, I was very clear to the reporter. I said some people are doing a very, very good job, and some people are doing a very, very, very poor job when it comes to releasing tongue ties and the administration of it. She said, "What do you think? Is it overdone or underdone?" I said, "I do know that sometimes it's overdone. You walk into a clinic, it doesn't matter what, there's a conference, it was called Tequila and Tongue Ties, that are talking about how you can make a bunch of money doing tongue tie releases. I know that that exists. Okay, that exists in all aspects of dentistry, medicine. It's disgusting. It exists and we acknowledge it. Yet there are a lot of great doctors who are doing this
Hmm.
to actually help, and so you can't pick on the one off. The truth is that there are some individuals who are overdiagnosed, yet also many who are underdiagnosed. I think tongue tie may affect about 25% of the population, with 5% having it quite severe. In babies, it's sometimes mixed the results because they can reattach
Right.
because of poor wound care. So that's one area, and it's challenging to do. So it's highly technically sensitive and requires preoperative body work, good release,
Post
postoperative
op.
management, and body work, as well as lactation consulting for you to see an impact. If you're just clipping it and running, it's going to reattach. You're not going to see an improvement. What's the point? And
Yeah.
that's what I
And
told
now
them.
you have scar tissue.
They have scar tissue. So that's obvious. I'll tell you, if you're just going for a tongue tie release in isolation, you're going to get a bad result. All right, I'll tell you that.
Yeah.
But if you do the body work first, the appropriate timing of the release, maybe some oralays, deep tissue laser therapy to loosen it up, appropriate, not aggressive, wound care, serapeptase, lactation consulting, body work, you're gonna get a good result. I had both my kids released within the first month of life. Um, And so I can tell you, I'm so happy that I did it at that time. Now, in young children, it works really well. Okay, we're talking like 3 years to 12 years. You see like amazing changes in terms of tongue posture, growth, development, speech, and things like that. As you go through puberty and to adulthood, adults with tongue tie typically also have problems with tongue space, which means that the tongue tie has caused the jaw structures not to develop to their full potential. And that lack of tongue space causes other issues that also have to be resolved. As such, it works really well for kids with pediatric lip breathing issues. For adults, is an adjunct to other modalities such as palate expansion and myofunctional therapy and body work and things
Yes.
like that.
You have to deal with in the adult, the non-growing adult, you now have to deal with the sequela of the tied tongue and all the growth and uh, development modifications that happen as a result of a tethered tongue not functioning. I mean, the tongue is nature's expander. You know,
Absolutely.
it drives growth. You know, it does so much. It does so much. And that's the beauty of osteopathy. It's, you know, and the older I have gotten, you know, I'm just so much more open to just different viewpoints and ways of thinking. And I know that, you know, they've been, you know, touting, you know, cerebral spinal fluid and primary respiration and the importance of moving that cerebral spinal fluid. And now we have science supporting and showing imaging, you know, granted it's like a sped up uh video of it, but you can see the pumping of that cerebral spinal fluid and cleansing of the brain, right? We can see it now. They've been saying it for decades and decades and decades, and they're like, we can feel it. And it was just very voodoo and you know, snake oil. And now we're seeing in sleep medicine the importance, like the research coming out on dementia and slow wave sleep and the importance of, you know, the pumping of the cerebral spinal fluid, cleansing that brain, getting all that stickiness out of there, and helping with cognitive health in adults. I just think there's so much. It's an exciting time, Soroush.
It really is.
It really, really is. I think we're seeing things that we have intuitively, anecdotally, have seen working in practices for our patients, for ourselves, and we're starting to see science literature start to say, you know, there is a little something to that. So hopefully it's going to keep coming more and more and more.
Yeah, and thank you so much for this amazing platform that you have. What a great opportunity for parents and community members as well as young doctors and medical students and existing doctors to learn from. I think it's so great that we have access to new knowledge and new information. I personally have my Instagram at Soroush Zaghi MD. If people want to follow along, I try to post, interesting new things as I discover them and I find that, it's relevant. Always happy to come back and continue the discussion in any way that you think is helpful.
Love it, love it. So it's at Soroush Zaghi MD. Guys, I'm going to have these links in the podcast when this is pushed out. Also, there's zaghimd.com and there's the breatheinstitute.com. I'll put your lovely wife's um, uh, Instagram. You mentioned that as well from the diet nutrition perspective as well. I'll put that in the podcast. But I ask everybody before they leave just three random personal questions. So I
Let's do
hope
it.
you have just a minute.
Let's do
Okay.
it. Yeah, yeah,
One,
let's go.
three, one. What is your favorite pastime?
Right now I love spending time with my kids.
I
So
love it.
yeah, I love taking them to the park, to the beach, for a walk outdoors. It's my absolute favorite thing to do. If you asked me 3 or 4 years ago, I would have said I love to go surfing and I love to go, um, you know, uh, skiing and things like that. But right now I have like a 4 and a 1 year old just getting off from work early, taking them for a walk, or if I have a late morning, taking my 1 year old to the park. It just brings me so much joy. I can't even tell you.
Well, it sounds like they were all outdoor things that you love
That's
to do.
true. Yeah, I do like to be
So
outdoors.
so you
Yeah.
just shifted it to include your kiddos and
Oh,
what
it's so
the
much more enjoyable.
memories.
Yeah, taking your little like 1 year old to the beach and putting the hand in the water and having them get messy in the sand. Like I prefer, I used to love getting in the water and going for a swim, but just watching my kids kind of play with it and just like
Yeah,
being on top of them and kind of making sure that they're safe is like almost more enjoyable to me than going in myself. And
I
it's a
love
different,
that. Well, you can see their eyes,
you
you
can,
can
yeah.
see their experience for the first time. It's magic.
Oh, it's magic. It's just
It
magic. And
is,
we
and
play
there's
together
nothing
and it's
like
just
it.
like I can't wait to like a little bit older so we can go to like Costa Rica together and go on ski trips together and go, rafting and I have two boys, so
Oh,
super
I
super
love
excited.
it. I love it. Okay, second, what's the last song that you listened to?
The last song that I listened to, uh, it's gonna be weird, but it's Twinkle Twinkle Little Star. Okay,
I love it.
my kid
Okay.
my kid loves that song. Okay, he's 1 years old, and he can almost like say the words to it. There's
Aw.
that song. There's another one my wife does that kids like too. It was it Hush Little Baby. Oh man, it's good and it also drives you crazy at the same time.
Yeah. And once
But
it's in your
unfortunately,
head, you can't get it out of your head the rest
that's
of the
kind of
day.
like what it's like. That's right.
Yes, I love that. And then what is the best compliment you feel you've ever received that stuck with you?
Yeah. You know, uh, that I changed someone's perspective about something in a positive way, or that I empowered them. So I sometimes get messages from people that, hey, thank you so much for your platform. Thank you so much for your research. I want to share with you, I went to this doctor that you trained, and my kid is doing so much better. Or I tried what you said, and just thank you so much for that. That gives me a sense of meaning and purpose, and it fuels me to kind of continue when I see the positive feedback from the community. Because I was trained that the highest pinnacle of success is to be a chairman of an academic department and to have NIH funding and to be, respected in that regard. And I made the decision that I'm here for the people and for the patients. And so when I get that feedback, it kind of fuels me, even though we see so much resistance from the outside community.
Well, I love that because we choose what our legacy is going to be.
Absolutely
And
beautiful.
I believe our legacy is so important and it's so much more long lasting if we invest in others and make an impact on other people's lives. That legacy just goes on and on and on and on. So you have touched so many, Soroush, and
Thank you so
um,
much.
yeah, just an honor to have you today. And
Amazing, amazing. Thank you so much
thank
for this
you so much.
opportunity. Hope you guys
Absolutely.
learned and enjoyed, and thanks for listening along.
Thank you. Thanks, everybody. And if you want, please subscribe, like, share this podcast episode. I'm sure so many could benefit from it. And if you're interested in what's up in the ASAP pathway, we have a free newsletter, and I'll have that link as well. Thanks again, Sarush. Bye, everybody.